While many doctors were surprised to learn that people could develop long term chronic symptoms after COVID, also known as long COVID, many of us in the functional medicine world gave a collective duh. Let's talk about it. Hey everybody, it's Dr. David. I hope that you are doing well. For many years, and maybe the most boring little catchphrase that I ever made was that bacteria are boring and viruses are variable. And what I meant by that is for most people with bacterial infections, that it's kind of a particular syndrome, whether it's strep throat caused by group A strep, or pneumonia, or which being caused by streptococcal pneumoniae or pneumococcal pneumoniae. Something mycoplasma pneumoniae. But they would kind of stay to certain places like staph staying to the skin, E. coli being in urinary tract infections, and they kind of knew which antibiotics to use, and it kind of ran its own course. But with viruses, very different. Obviously, as we even saw with COVID, that SARS-CoV-2 could make some people asymptomatic. Other people could be just a cold. Other people will be more severe to the point of hospitalization, or where it's even taking people's lives. And lots of viruses can be that in that variable sense, that in the same virus can cause 10 different people, 10 different types of symptoms or severity. Okay, so that is kind of like the premise of where I'm coming from today, because, we're going to be talking today about a study that looked at not just COVID, but other acute respiratory infections and the long or chronic symptoms that they could be causing as well. Now, of course, back in when COVID had started, we were seeing thousands of deaths a year. Even a year later, in February of 2021, we actually got to a peak where there were 5,000 people dying a day. Now, of course, my long or chronic perspective, I guess, unfortunately, you could say that was the extreme, if you will, of long COVID, although it could have been short. But there were people who were in the hospital for weeks and weeks before they perished. I know somebody that happened to. But nonetheless, obviously, when we were talking about a very severe disease, people weren't necessarily focusing on the long-term sequelae, the consequences, because we were dealing with a very acute situation at the time. Okay. Now, thankfully, those days are behind us. Really, it's incredibly uncommon. People are no longer passing away from COVID, except for very unusual circumstances. We obviously know more about how to strengthen the immune system. We now know that there are certain medicines that we've been able to use throughout this. So we obviously know that the overwhelming majority of people, like 95% or more, now have immunity, whether it was through wild disease or if they chose to be vaccinated. So we're just not dealing with the same consequences from a acute hospitalized or deathly situation when it comes to COVID. Okay. But there are still plenty of people who are dealing with long COVID, who are dealing with chronic symptoms that can be lasting a year or more, from chronic fatigue to the loss of smell, the loss of taste, chronic coughing situations, etc. Now, as I said, there's now some new research that has looked not just relative to COVID, but are showing that this can be happening with lots of other viruses, influenza, other types of respiratory viruses that are more associated with colds that you typically think of you get over after a few days, but not everybody is. Okay. Now, again, people really shouldn't be surprised of this, because we've seen circumstances like this before. Now, mono, for instance, which can cause chronic fatigue, which we know is caused by other viruses, but very well known with Epstein-Barr virus, or EBV. Okay, and that can go on to cause mono, which can go on to create a chronic fatigue syndrome, which is now actually known as, let me get this right, myalgic encephalomyelitis. Okay, so this is now chronic fatigue syndrome, which used to be thought of as a more psychosomatic, for that people would get these types of chronic fatigue because it was really all in their head. It was really attributed mostly to women, and hysterical women who were just, their emotions were taking over the body. And that's obviously been very shot down now. That's not really a belief anymore. But when I started doing my training 25 years ago, that was kind of one of the things that was considered as a hypothesis. But again, that hypothesis has been shot down now. So another thing that people have heard of, especially if you're in the pediatric world, is what is called pandas and pans. Now, pandas is a is a pediatric autoimmune neurodevelopmental symptoms associated with strep. So this was one of the variable places that strep did make a difference, but it was a post-infection. Okay, not the infection itself. So again, like long strep, I guess you could think of it. But we then learned over time that it wasn't just strep that can cause this. Lots of viruses, mycoplasma, bacteria can cause this. So lots of things. But the thing about this particular condition is that there would be a sudden onset, that it would happen after a person had an infection. Usually it would involve things like sudden onset of OCDs, anxiety, social anxiety, tics, abnormal behaviors, etc. And a lot of times when people would have this condition and who have this condition, where they will get better and then they'll crash again, and they'll get better and they'll crash again. And a lot of times those subsequent crashes can happen from any type of infection. Okay, so as if the immune system is not reacting properly, which we'll get into that in a little bit more. Now, in addition to that, myself, and influenza has been shown to have like a long flu as well. And my own situation, and this is probably about 7-8 years ago, maybe a little bit more, where I developed influenza. And for me, it just went on where I was spiking fevers for about a month afterwards. I would be just talking to a patient, and then I would just start profusely sweating. They're like, "Are you okay?" I'm like, "Yeah, this is just a weird thing that's happening to me." I lost hearing in my left ear about 70-80%. That took about 2 months for it to come back. And I just felt lousy for that entire period of time. Not too dissimilar from long COVID and what we're hearing. And it did happen to me again a couple years later. And, that's why after the second time of it's happening, and it was just clear to me that influenza virus and my body just does not react properly together. And since I had taken influenza vaccine many times, because you had to back in medical school, and when I first started practicing, etc. So that's when I started taking annual flu shots again. I've never had any side effects from it, but in my personal weighing the pros versus cons, I mean, I was out of the office for 3 weeks. I can't do that to my patients, let alone how crappy I felt. So for me, my pro versus con is I get a flu shot, and I haven't had this happen since. So, each their own, right? Now, in terms of with long COVID, though, there's been different studies that show anywhere between 7 to 30% of adults get some type of long COVID types of symptoms. Interestingly, it's only about 1 to 1.5% in children. Maybe that's not so surprising, since we know that the severity of COVID itself was much less likely to happen in children. But there's this new study in Lancet that I'm going to talk about, and this is part of what's called the Covidence. Covidence, so it's like kind of off of confidence. Covidence UK. This is a program in the United Kingdom. Now, this is a prospective population-based study in United Kingdom, and it was looking specifically at adults. Now, interestingly, in there, because they have the single national health system there. Okay, so everything runs through the same system. There's not insurances that are and private doctors' offices. You can say that's good, you can say that's bad, but one thing that is about that is their ability to collect data and have it centralized is much better than what we have here in America. Okay. And so this tighter records may make that this may be more accurate data. Okay. And what they did is they looked at over 10,000 individuals. All of them were not vaccinated against COVID. Okay. And that was a part of the starting point. So they can try and just get a baseline immune response to it. Okay. Actually, there's over 14,000, I meant to say. About 10,000 of them were people who had tested positive for COVID. And then 472 of them had an upper respiratory infection that was not COVID. Okay, and those that we compared. And then they also did compare it to about people who didn't have any infections all during that time period. Okay. And all the time period, it was over a few month period of time where they collected the data back in early 2021. Of course, they then had to go back and ask questions afterwards. And so, as with any study, it's going to take 2 years for it to come out, which of course makes it not so helpful for us now, but it's good to look back. Okay. Now, as far as this, they were looking and asking people about a series of questions of symptoms. There was actually 16 different symptoms that they were asking. And in particular, they were asking about things like shortness of breath, difficulty breathing, difficulty concentrating, dizziness, memory problems, stomach problems, coughing, and sleeping trouble. So a very wide variety of different types of symptoms, but every one of those symptoms has been associated with long COVID. But they asked the questions for the people who didn't have COVID as well. Okay. Now, they did find that for any of these things, the more severe that a person's symptoms were for the actual infection, the more likely they would go on to develop long symptoms. And that was true for both in COVID as well as non-COVID. And so what they really found, though, is that these long symptoms were present in the non-COVID people as well. All right. Now, it's been hypothesized that the reason why this is happening in the first place is because some people's immune systems, their ability to contain inflammation, is better or more compromised. Okay, I kind of think of it as Goldilocks with our immune system. You don't want it too weak because you're more likely to get severely ill. You don't want it too strong because that's where inflammation, hyperinflammatory symptoms come into be. So we want it just right. And so that's why we've continued to talk about things like starting our immune protocol at the beginning of the first signs of illness to try to let things not get too out of control in terms of the virus, because that brings a stronger immune response. But also, as we've continued to talk about, making sure you have really good middle of the road vitamin D levels, zinc levels, tending to the microbiome in the gut, because we know the importance of the gut relative to inflammation in our body, our immune responses overall. Okay. Now, so in terms of from a food for thought, okay, now that it's more commonly recognized that this is happening, maybe we will understand a lot more about this, right? And one of the fair things that I think is fair to ask about is, could there be the concept of long vaccine? Okay. And I know that's a controversial thing, but, certainly if you look at the package inserts of the different vaccines, whether it's the myocarditis that we know is rare and is more likely to happen if a person were to get COVID, but also, in terms of some of these other things, we know that Guillain-Barré, for instance, this is a post-viral disease, a syndrome that causes an autoimmune attacking on the spinal cord. But we do know that it also happens, it's documented in the package insert, for certain vaccines. It's it's common with influenza vaccine, although it is 17 times more likely to happen with wild influenza. Okay, but it has also been shown to happen with the shingles vaccine that is used for adults as well. So, for us to say that it is impossible to have a similar type of reaction when a person has an immunological response to a vaccine, when they can have these same immunological reactions to a virus, or in the case of pandas, a bacteria, I think it's closed-minded. Okay, and I think a lot of more research needs to be done on this. But, I've clearly through the years, with COVID and otherwise, and I've certainly seen a lot of people who did not have any problems with vaccines. It's the overwhelming majority of people who don't have problems with vaccines. But at the same time, there are people who have vaccine reactions. Look at the vaccine adverse effect repository, VAERS, I don't know if that's what the R stands for, reaction system, I think that's what it is, RS. Clearly, there are people who are reporting that. There are doctors who are reporting this. They do happen. And so, I just would ask people to be open-minded to the possibility that these things, even if they're more likely to happen from wild disease, they can happen from vaccines too. And maybe just like one of the things that the study authors for this long COVID, long virus study did, they said that maybe that this will inspire people to do more research as to what is actually happening immunologically to people. Are they having changes in their cytokines, in the types of white blood cells, their B and T cell responses? What's making a subset of people go on to have long symptoms? And again, I would ask the same question whether it was an artificially induced immunity through a vaccine, since we know that it does seem to be happening with wild viruses. All right. Well, hope you have a good day. Bye-bye.